Благоприятно выполненная операция – это еще не значит окончание лечения больного, потому что послеоперационный период чреват самыми различными неожиданностями, в том числе воспалительными осложнениями со стороны операционной раны. Эти осложнения занимают различную группу, но тем не менее причина их одна – инфекция. Микроорганизмы и вот борьба с микрофлорой как причиной развития воспалительных осложнений является использование различных средств и методов, обладающих антибактериальными действиями. Наше совещание посвящено использованию различных вариантов шовного материала, швов, которые обладают антибактериальным действием.
Компаниям, производящим медицинское оборудование, фармацевтические препараты, мы обязаны той редкой возможностью общения между собой, общением с иностранными коллегами и, самое главное, доступу к мировой информационной базе, которая позволяет проводить нам собственные исследования, быть в курсе всех тех инноваций, которые имеются в мире, и, соответственно, лучше лечить наших пациентов.
First, it's a great pleasure and an honor to be here with you in Kazan, and I've been invited here to talk about my interest in healthcare-associated infections, which are really caused by doctors, and particularly the overuse of antibiotics, which has brought out all these resistant organisms, which are a big problem, and they're rising. My big interest is in surgical site infection, which is one of the healthcare-associated infections. And I'm pushing very hard in my own country that to try and prevent them, we should try and develop what's called a care bundle, which means looking at 4 or 5 factors that, if all observed together, might reduce the incidence of surgical site infection. The big 4, I guess, would be proper and careful antibiotic prophylaxis, which usually means 1 shot at the start of surgery. Making sure patients stay warm pre-operatively and during their surgery is very important. Shaving is another one. It's been shown that if you shave patients just before surgery, you can increase the risk of surgical site infection. And more recently, there's been an interest in managing blood glucose properly. So pulling all these things together and making sure that they're complied with really does help. But of course, at the bottom end of all this, it's very important that the surgical team really work together and talk about this, work as a group, and that seems to come off quite well. But we're working hard at that in Europe, and I think healthcare-associated infection is dropping, surgical site infection is as well. But what's been interesting to come here today is that we use the same definitions and the same methods of surveillance to be sure we're measuring the same thing, and we are, surprise, surprise. So I think we can work at this together. And that's going to be very exciting.